Doctors, we are live. We can go ahead.
Good evening, friends, and welcome to the first semi-finals of season 2 Big Q, that is an all India postgraduate quiz. Just to remind you, this is the Kahoot pin which is given and how you have to name your mobile number followed by this. It is already explained amply. So this last quiz during the quarterfinal 4, somehow we forgot to declare the audience winners. And please note the viewers who are there. These are the people who had won the audience prizes in the last episode. We got a lot of messages regarding not having shared. These are the people who won the audience prize. We will declare the name later on. So this is a pan-India intercollegiate quiz, which is being done by Brain Teasers in association with Ophthalmological Society of Nagpur, and it is called the Big Q. And this is the signature tune of our Brain Teasers. This is the 4th season of Brain Teasers. And this is the big.
At the end of the day, ऊपर तेरे लटकी है परफॉर्मेंस की तलवार, ऐसी दरिया है ये, रिमेम्बर कर ले, जो डूबे वो ही होता है पार। जो भी आए यहाँ पे उसको चांस एक मिलती है, हर नजर की यहाँ पे सोचो एक मंजिल ही है। मौका मिले तो खोना नहीं, कि आएगा ना ये बार बार।
So good evening once more and welcome all the participants, and my pranam to all the gurus, that is mentors, who have logged into the first semi-finals of second season of Big Q. I wish you in advance a very happy Ram Navami, which is a Hindu festival that is celebrated on the birth of Lord Rama, who is supposed to be the 7th avatar of deity Vishnu. This festival celebrates the descent of Vishnu as a Rama avatar through his birth to King Dashratha and Queen Kaushalya in Ayodhya. This festival is a part of Chaitra Navratri in the spring and falls on the 9th day of bright half, that is Shukla Paksha of Chaitra, the first month of Hindu calendar. So once more a happy Ram Navami to you in advance, because tomorrow is going to be the Ram Navami. Now coming back to the Big Q, we have completed 8 preliminary rounds with 630 teams, 4 quarterfinals with 80 teams who played the quarterfinals, and today we have the first set of 11 semi-finalists to play with us the first semi-finals. So once more, congratulations to all the 11 teams, and a warm welcome to the semi-finalists, and of course to their proud mentors. Well, friends, postgraduates who could not make into the quarterfinals and now into the semi-finals should not get disheartened and quit. As I said some time back, all the 630 teams played extremely well, and there was hardly a matter of difference of few decimals. But quizzing is also a game, and someone has to win and someone has to lose. But truly speaking, all the participants who dared to enroll and participate are all winners in my eyes. And my big congratulations to each and every team member and their proud mentors. So let's keep learning and having fun. You all keep following us and play in the comprehensive category meant for general ophthalmologist. For the first semi-finals, we have today 3 quiz masters. My dear friend, who is a professor from AIIMS Hyderabad, Dr. Arvind Maurya, who has lately got into the habit of pocketing multiple awards at every conference he attends. He's a prolific anterior segment surgeon, and also an avid reader as well as a quiz master now. The second quiz master is Dr. Purvi Bhagat, who is professor and head of glaucoma services at M&J Regional Institute of Ophthalmology, Ahmedabad. She has been a gang member of our brain teasers from last 3 seasons and is an integral part of our team. Dr. Sugato Paul, an eminent phaco and glaucoma surgeon from Kolkata and a dear friend of mine. He was also a chairman scientific committee of OSWB, that is Ophthalmological Society of West Bengal. Also, he's an avid quiz masters, and you will learn as you see through the proceedings. So welcome all the quiz masters. We are thankful to Mr. Sai Krishnan and his numeratic team for giving an efficient back office for smooth conduct of this online event. We are also thankful to Microlabs for their generous support, and I would fail in my duties if I don't specially recognize Mr. Ashok and Mr. Navneet, who have really worked out to reach out to every student in any corner of our country. Now, here is a small promo from Microlabs. Thank you, Microlabs, for making this our dream of having an online quiz, all India postgraduate quiz possible. It was not without your great financial support, this would have been possible. Now, I request my colleague, Dr. Shilpi Narnaure, who is also a co-host of this particular program, to introduce you to the format of the quiz. Over to you, Shilpi.
Thank you, sir. Welcome all. Welcome to semi-finals 1. So hope you all are geared up. So here's a format. So today, as you all know, is the first semi-final of Big Q second. Second semi-final will be on next Wednesday at same time. So teams qualifying for the second semi-final will be declared at the end of today's episode. So keep playing and have a watch. So for teams, as always, you need to play from 2 platforms, that is Kahoot and Zoom. So participants need to log in from 2 devices, but only 1 email ID. First screen is live quizzing on Zoom platform, and out of the 4 rounds, 2 out of the 4 rounds will be face-to-face, and that will be only for the teams. And the second screen is the Kahoot platform. It will be common for the both audience and the teams. So from today's semi-finals, that is out of the 11 teams, 5 teams will qualify for the finals. And what is the criteria for qualifying? It is the cumulative performance of the prelims, your quarterfinals, and today's semi-final. And remember, we have tried our best not to repeat the questions, but let's see. So coming to the rules, the MCQ has, each set has 5 questions. So 10 seconds per question will be given to you. There will be no negative marking in the MCQ part. The second round will be the one-liners. Again, each set has 5 questions. For that, 20 seconds will be given to you for every question. And there also will be no negative marking. In one-liners, preferably it will be 1-word or 2-word answers, and you need to type the answers in your Kahoot platform. And this is the format that is only teams with face-to-face will play with the quiz masters, that is case-based questions. So there will be 3 questions you need to answer in 20 seconds. For correct response, plus 10 marks, and for incorrect, it will be the deduction of your 5 marks. The 4th round will be the rapid fire, again only for the participants on the Zoom. You need to answer 5 questions in 30 seconds, again with the negative marking in the same. So teams who don't qualify for the semifinals 1, you can play as audience, as an individual. You need not play it as a team. So these, you can download your participation certificates from this site. So now I introduce our first quiz master, Professor Dr. Arvind Kumar Maurya sir, who won the Ophthalmic Star Award at Amsterdam in ESCRS 2021, AIOS International Hero Award for year 2021, first to receive AIOS Senior Academic Achiever Award again in 2021. He was a National Medical Advisor on COVID screening trial based on artificial intelligence, and he is heading many projects based on AI on DR, glaucoma, and Alzheimer's. He has more than 300 national and international presentations, 100 of and more national and international publications. He is associate editor of UKJOS, section editor of IJO, editorial board member of EC Ophthalmology, IJCC, IJOVS, DOS Times, and JHOS. And he has conferred many oration awards in various conferences and is an invited international faculty. Welcome you, sir. Our second quiz master is Dr. Purvi Bhagat ma'am from Ahmedabad. She had 80 publications, more than 175 presentations. She has done his international fellowship in medical education, FAIMER. She has done the various prestigious leadership programs at local, state, and national societies. She has also won the various awards like Outstanding Woman Work Award in 2015, Role Model of the Year in 2016, Best Coin Award in 2016, then Secretary Silver Plug in 2017, Leadership Award in 2017, and the list goes on. And the last award she won was recently as the Star of the Month, BJ Medical College and Civil Hospital in Jan 2023. Welcome you, ma'am.
Thank you so much. Thank you.
And our third quiz master is none other than Dr. Sugato Paul sir. He is a consultant eye surgeon at Amulya Jyoti Eye Foundation at Kolkata. He is a former trust consultant and director at Diabetic Retinopathy Screening, Wigan and Lake NHS Trust, UK. He is joint secretary of OSWB and managing committee member of Eastern Indian Zonal Ophthalmological Congress. Welcome you, sir. So now I invite Arvind sir for the MCQ round 1.
Good evening, ladies and gentlemen, boys and girls. I hope you are ready for the first semi-final in the Big Q. Thank you, Prashant sir and Dr. Shilpi for giving me the opportunity. So we will start with the MCQ round 1. And the first question is, which premium PCI IOL is independent of pupillary size, no dysphotopsia, and PCO incidence? And your options are A, multidiff, B, supraphobe region, C, revive multifocal, or D, autofocus pro. And your time starts now. And
hold on, doctor, hold on, doctor. Doctor, hold on, please. Yeah, you can go ahead.
And the answer is D, autofocus pro, because its optic size is more than any other these kind of premium IOLs. Next MCQ, please. In Creutzfeldt-Jakob disease, which is false? And your options are: the protein content of the CSF is raised, B, EEG shows characteristic waveform, or C, death usually occurs within 12 months of onset, or D, cortical blindness is common. And your time starts now. Sai, are we ready?
Yeah, you can go ahead as usual from now on.
And the answer is the protein content of the CSF is raised. This is the false. All other things are correct in Creutzfeldt-Jakob disease. CSF is normal, but EEG shows the characteristic periodic triphasic waveform, and cortical atrophy involving the frontal, parietal, and occipital lobes are common. And it is caused by a slow virus whose genetic material is still under study. Next MCQ. In multiple sclerosis, which is false? A. Onset with optic neuritis or sensory symptoms tend to have better prognosis. B. Low amplitude of visual evoked potential strongly support optic nerve involvement. Or C. Oligoclonal band in the CSF supports the diagnosis. Or D. The prognosis is worse for males than the females. And your time starts now. And the correct answer is B. Low amplitude of visual evoked potential strongly support optic nerve involvement. Because this is due to delayed visual evoked potential. Next, name the study which showed focal argon laser photocoagulation reduced visual loss in patients with macular edema due to BRVO with a vision of 6/12 or worse. And your options are A. ETDRS, B. OSTS, or C. BVOS, or D. AERDS. And your time starts now. And the correct answer is C. BVOS. Show us the explanation. It is the branch retinal vein occlusion study looked at the benefit of laser on macular edema and neovascularization in BRVO. Next MCQ, please. And the fifth MCQ is 78-year woman is on anti-glaucoma eye drop for past 20 years. IOP in both eye measures 18 millimeter of Hg. An examination reveals presence of black deposits in the lower tarsal conjunctiva of both eyes. What medication is she likely to be on? And your options are A. Brimonidine, B. Pilocarpine, or C. Dipivefrin, or D. Latanoprost. And your time starts now. And the correct answer is C. Dipivefrin, because it is a product of adrenaline. So it is oxidized to adrenochrome and it causes the black conjunctival deposits. Over to you, Dr. Shilpi.
Thank you, Dr. Arvind, for wonderfully taking us through the first set of MCQ. Now it's time to change the gear and come back to the team one. Team one, we have Dr. Sahala and Dr. Reshmita from RIO Trivandrum, and the mentor is Dr. Anita. Can I have the team one? That is Team Spark. Can you get your video on? Yes, are you there with us?
Yes, sir.
Okay. So we can hear you well. Can you just introduce yourself in a short 1 or 2 lines, as well as tell about your mentor?
So I am Dr. Reshmita, final year resident from RIO Trivandrum.
I'm Dr. Sahala, final year resident from RIO Trivandrum.
Our mentor is Dr. Anita Balachandran.
Okay, Doctor, you have placed your video in a very strange way. That is why Dr. Sahala, we can't see you. Only Dr. Reshmita is all over the video. We would like to see both of you. Okay, no, get your video properly in, because all the teams who are being you are being playing and you are being watched by thousands of people. Okay, viewership is quite high. Again, still I can't see Dr. Sahala well. Come on, you center. That's the way. That's it. So now it's time for you to play the first case-based round with Dr. Purvi Bhagat. So Dr. Purvi Bhagat, all the team is with you.
Yeah.
Team one is with you.
Thank you so much, and all the best, Team Spark.
Thank you, madam.
Yeah. So can we have the first question, please? Yeah. So she is a young female complaining of intermittent migraine-like headache and shows this finding, what you see on your screen, on slit lamp examination. Now I'll pose the 3 questions, and for that the time starts
Migraine
now.
young female.
Name this clinical finding.
Delicate is correct.
If you're not sure, you can pass it right away because
Pass.
yeah. In which condition is it most commonly seen?
Fuchs uveitis.
That's a negative marking for you. And which other associated findings? Triad. Okay, so I'm so sorry. In fact, you lost 5 marks from nothing what you had. So the clinical finding is glaucom flecken. What you see, they are anterior subcapsular opacities, and they are seen in acute angle closure glaucoma. And when glaucom flecken is associated with dilated fixed pupils and iris atrophy, it forms a Vogt's triad. And it basically comes from the damage that happens due to ischemia, resulting from acute rises of IOP, which is seen at acute angle closure glaucoma.
I
So
think
sorry,
even-
Spark.
No, I think they answered the last question as Vogt's triad. If you means they did say that, I believe. Correct? The previous.
Yes, sir.
Yeah,
Yeah.
but
So
okay.
I think this Vogt's triad, they answered it rightly. Should we give it totally, or we have to explain the other
yeah,
clinical?
because actually, yeah, we
Yes,
had
ma'am.
asked for findings, associated findings, which
Okay,
constitute the triad, not the name of the triad.
Okay. So that team, you get only -5. So now it's time for us to move on to the rapid fire round with Dr. Sugato over there. Now remember, you have finite 30 seconds to be answering the 5 questions in total. So if you are sure about the answer, please delve upon it. Otherwise, move ahead. Otherwise, you will be losing upon your important finite 30 seconds. Over to you, Dr. Sugato. Dr. Sugato, are you there with us?
Yes, sorry, I was muted. So thank you for making me part of this quiz. So Sai will be sharing the question on the screen. Yeah. So here comes the first question for you. Normal AV ratio of the retinal blood vessel.
2:3.
Crystalline lens is embryologically derived from. Leash nodule is seen in.
Neurofibromatosis.
First glaucoma device used was.
Burwell.
Visual acuity in the newborn is.
Less than 60.
Pass.
So, okay, so here comes the answer. So 2:3, you got it right. Surface ectoderm, you got it right. Neurofibromatosis, you got it right. The first glaucoma device used was Molteno. So there is a small negative marking for that. And the visual acuity in newborn is 6/120, which you passed. So 3 right and 1 wrong.
25
So they get the
Thank you.
25
Well
marks.
played.
Well played, team RIO Trivendrams, that is Team Spark. Now it's time for me to invite the next team, that is Team 1 RIO PGIMS Rohtak. And it is going to be Dr. Supreme Goyal and Harshvardhan Chilkoti. Can you get your video inputs on, please?
Yes, sir, we have put video on.
Okay, well, so now it's time for you to first play the clinical question and then followed by MCQ round, rapid fire round with Sugato Paul. So over to you, madam. Please do introduce yourself first. You and your.
Good evening. I am Dr. Harshvardhan Chilkoti.
I am Dr. Supreme Goyal and we are from PGIMS Rohtak.
And your mentor is, of course, Dr. Chavan, sir. We can't hear you. We can't hear you. You have to be loud, otherwise you will be missing upon your answers.
Okay, sir.
Okay, over to you, ma'am.
Yeah, thank you, and all the best, team 1 RIO. So a case of a young adult male who is concerned about such black spots in his eye. He has no other complaints or clinical findings. Okay, and your questions start now. What are these hyperpigmented black spots called?
Pass.
Yeah. Which anatomical structure are they associated with?
Pass.
What will you do for this patient?
Observation, nothing. No active intervention.
Okay. So I think the last one we can consider, these are basically axon field nerve loops and they are associated with the long posterior ciliary nerves. Can I have the explanation, please, Dr. Shilpi? Yeah, so these are loops of the long posterior ciliary nerves within the sclera, just 2.5 to 3 millimeters posterior to the limbus. And they appear like these grayish white nodules under the conjunctiva, and they are just normal anatomical landmarks. They are totally, kind of a benign findings. And so all that the patient needs is counseling. So for counseling, yeah, you get +10.
Yes, sir.
Nothing
Well
to be
played.
done.
So now over to you, Dr. Sugato sir, for a rapid fire round. Remember team, you have 30 seconds to answer Sugato's next 5 questions. Sugato da, are you there with us?
There, and the first answer will be taken as the right answer or wrong answer. Okay, first response. So here comes the first question. Yoke muscle for the right superior rectus.
Left inferior oblique.
Okay, next question. Secondary vitreous is embryologically derived from?
Pass.
Next question.
Down syndrome.
Raffle spot.
Down syndrome.
Next.
Squint angular deviation.
Centered.
Squint.
Next question, please. Bleomycin is used for which ocular condition
Retinoblastoma.
treating? Okay. Do you want to go to the question which you have passed? No, you have already seen. So the first question you answered was?
Left inferior oblique.
Okay. Then secondary vitreous you passed. Down syndrome is right. Centered is right. Bleomycin is used for treating hemangioma. So you got 1 wrong and you got 3 right. You passed 1.
Now, well played team RIO. Now it's back. We will go back to the third.
Sai,
Yes, sir.
Sai, don't show the answer till 30 seconds are over because they might want to go back to the questions which they have initially passed if they are allowed to do so.
They had exhausted their 30 seconds.
30 seconds. Okay.
So now it is time for us to move to the next team. That is Team Stargard from Jawaharlal Nehru Hospital, Raipur. And it is Dr. Bhavna Agrawal and Dr. Sakshi Sahu. Can we have your video inputs on? Yeah, welcome. Please do introduce yourself as well as tell about your mentor, and then we'll take you to the clinic bed round with Dr. Purvi.
Myself, Dr. Bhavna Agrawal, third year PG resident from Raipur, JNM Medical College. And myself, Dr. Sakshi Sahu, third year PG resident from JNM Medical College. Our mentor is Dr. Resha Malhotra.
Okay, well, welcome. Over to you, madam.
Yeah, all the best, Team Stargard. So, Dr. Shilpi, can I have the question, please? Yeah. So a 50-year female in one of her early follow-ups post full thickness keratoplasty, she presents with decrease in vision and shows the following clinical picture. In your time and questions, start now. Name this clinical finding.
Kodados line.
Okay. What does it signify?
Acute graft rejection.
What is the primary modality of treatment?
Pass.
Okay. So yes, these are Kudados lines. So 10 points for you. It does signify corneal rejection, basically endothelial rejection. And because it's a case of rejection, the primary modality of treatment would be intensive steroids, topical as well as systemic. Okay. So Kudados line, basically they are named after Dr. Ali Asghar Kudados, who was the person who identified and described these. And these are cellular infiltrates that aggregate on the corneal endothelium. And this line migrates from the periphery to the center, causes decrease in vision, and is accompanied by stromal edema. And it is actually considered the hallmark of graft rejection. The moment you see these lines, you have to treat intensively and aggressively. Okay. So 20 for you. Congratulations.
So now over to Dr. Sugato sir.
Very well played. So here come the first question. Number of short posterior ciliary arteries in each eye.
4.
Okay. Sphincter pupillary muscle is derived from?
Pass.
Horner Strunter spot is seen in?
Takuma.
Okay, next question.
Olicoplasmin is approved.
Ochriplasmin is approved for
Pass.
it pass. Next question. Where is PAC treatment used for?
So we'll go back to sphincter pupillary muscle.
No, you have existed your time now because 1 second was left. I gave you the fifth question.
I think we have exhausted the time.
We have exhausted the time. Okay. So number of posterior ciliary arteries, you said 4 is 20. Neuroectoderm you passed. Horner trunter spot is seen is spring cutter. You got this wrong. You passed ochriplasmin and you didn't answer the last one as well. So you got 2 wrong.
-10.
-10.
So well played, teams. Now it's again, let us go back to the with Dr. Arvind Maurya. We will be having now the one-liners for you. So Dr. Arvind Maurya, are you there with us?
Yeah.
Okay. So here starts all the teams have to now jot it down on the Kahoot platform. Okay. Are you ready? Very well. Over to you.
I welcome you all once again for the one-liners. So the first question is, synonym of Cupid's bow is, and your time starts now. The simplest of all.
Doctor, don't reveal the answer now. Yeah, you can go ahead now.
And the correct answer is, of course, pseudogerontoxin. Next question, please.
Just a moment, doctor, please. Can go ahead, doctor.
And the next question is, Egyptian ophthalmia, a chronic keratoconjunctivitis. What is the other name? And your time starts now.
Hold on, please, madam.
Yeah, sure.
Yeah, you can display the answer.
And the correct answer is trachoma. Next question, please.
Yeah, can go ahead.
Limbal conjunctiva has how many layers? And your time starts now.
Hold on, please, madam.
Yeah.
You can show the answer now.
And it is same as of cornea, 5 to 6 layers. Next question,
Hold on,
please.
madam. Hold on, please.
Sorry?
Just a moment, doctor. I'm just reviewing the answers.
The correct answer is 5 to 6 layers.
You can go ahead with the next one.
And the next question is, pathological myopia starts in which range of age group in years? And your time starts now. The range.
And show the answer now.
And the correct answer is 5 to 10 years. Next one liner, please.
Sai, shall I?
Can go ahead.
Okay.
And that part of hypermetropia, which can be corrected by the patient's accommodative effort, is known as, and your time starts now. Simplest of all.
Just a moment, please. Can show the answer.
And the correct answer is facultative. Over to you, Dr. Shilpi.
Yes, sir.
So now it's time for us to go back to the clinic beds round as well as rapid fire round with the next set of 3 teams. That is with, so the first team is team number 4 is going to be from Sitapur Eye Hospital, Sitapur. Dr. Komal Singh and Dr. Amina, you have to be with us. Can you get your video on, video as well as audio on?
Yes, sir. Good evening, sir.
Yeah, let's have a look at you. Yeah. So are you ready?
Yes, sir.
Please do introduce yourself as well as your mentor in a short. And
Sir,
then
I'm Dr. Komal Singh, third year PG from RIU Sitapur. I'm Dr. Meena Clark, third year PG from RIU Sitapur. Our mentor is Dr. Indranil Saha, who's a vitreoretinal consultant in our hospital.
okay, okay. So best of luck and over to you.
Thank you,
Dr.
sir.
All the best, Team Co-ME.
Thank you, ma'am.
So this is a slit lamp photograph of a patient having history of some corneal infection 8 months back. Patient has no complaints except for these yellowish white elevated lesions, and the patient is not on any type of medications. Okay. Your questions and timer start now. What is this keratopathy?
Pass.
What stimulates this keratopathy? Just 5 seconds left.
Pass, ma'am. Pass.
Name the commonest cause of this keratopathy. I'm
Pass.
so sorry. Yeah, your time is up and you couldn't answer any.
Infectious
of them.
crystalline to nahi.
So this keratopathy is basically just a lipid keratopathy, and the presence of new vessels, vascularization, it stimulates its formation, and the commonest cause is herpes simplex. So it's basically a stromal deposition of lipids in this area wherever the new vessels have developed, and the commonest cause is herpes simplex followed by zoster and trachoma. And if you treat the neovascularization by either argan or anti-VEGFs, then maybe you can even control the lipid deposition. Okay. I'm so sorry. Better luck for the next ones.
Yeah, so don't get disappointed. Now it's time for us to cover up with the next set of rapid fire round with Dr. Sugato.
Yeah,
Dr.
concentrate and you will be able to answer all of them. Okay. So best wishes. And your first question comes now. Which muscle in the lid is attached to posterior tarsal plate?
Orbicularis oculi.
Which type of cataract riders are commonly seen?
Zonular cataract.
Fisher-Coon spot is found in which structure of the eye?
Pass.
A scan of IOL, what A stands for?
Excellent.
Who invented cryo?
Pass.
Okay. So
He's
can we reveal the answer, please? Your time is up, so we'll reveal the answer. So it's molar muscle. You said orbicularis oculi. So -5 for that. Zonular cataract, you got it right. Now, Fisher-Coon spot is seen in sclera. These are basically senile hyalinized plaque. Amplitude you got wrong. And Charles Kellman, who invented phaco as well, invented cryo. So you got that wrong. So it was an easy round, but you have to keep your cool. Okay, so best wishes for the next rounds. So it was -5. So 0. They got 1 right and 2 wrong.
Yes, sir.
Yes.
Yeah.
So well played, team. Now it's time for us to move to the next team. That is going to be team from Little Flower Hospital, Angamali. And we have Dr. Vishnu Priya with us and Dr. Vishnu Priya as well as Dr. Rehina and Dr. Elizabeth Joseph, madam, is the mentor. Yes, team. Can you get your audio as well as video input on? We can't see you. Dr. Vishnu Priya,
Pizza Pie team.
Team Pizza Pie. Sai, can you check? Let's see the participants. Pizza Pie.
They logged in.
They had logged in. Just check.
Yeah, they are there.
Team Pizza Pie, you are there with us. Just unlock yourself, unmute yourself. Somehow we are missing upon them. So what we do is we will go one attendee. What are they showing? Okay.
We move with the.
Okay. Somehow we are not able to reach them out. Let's move on to the next team meanwhile. And that is going to be AJ Hawk from AJ Hospital, Mangalore. Dr. Akshay Bhandari and Dr. Shreya Jain. Can you join us?
Good evening,
Get
sir.
your- Yes, please.
I'm Shreya Jain.
I'm Akshay Bhandari.
We are from AJ Hospital, Mangalore, which is in Karnataka.
Okay. And your mentor is?
Dr. Samprita ma'am.
Okay, well, welcome. So you are now going to go through with the clinic round as well as the rapid fire round. So over to you, madam.
Yeah.
Purvika.
Yeah, thank you. So all the best, AJ Hawk team.
Thank
And
you.
I
ma'am.
have a question. Yeah, Dr. Shilpi. So a young myope healthy male comes to you for a routine refractive error checkup. The binocular corrected visual acuity is 6.6 both eyes with -5 diopter spherical. When you take the fundus photographs, some black images are seen in the fundus photographs as shown. And your timer and question starts now.
That is,
So what are these spots, these black highlighted spots called?
Pass.
With which condition are they most commonly seen?
Pass, ma'am.
And how do you confirm their diagnosis? Sorry, your time is up. So these are Ellen dots, most commonly seen with myopia. Basically, these are artifacts. Can I have the next slide, please? So when you use some additional lenses with your fundus cameras, they often cause such faint artifactual dark circular spots in the center of your fundus images. And if you see clinically, these dots will not be there in the clinical examination anywhere in the fundus. And if you see carefully in the photographs, they will be all similarly positioned in all the images. So clinical correlation will establish that these are artifacts. Okay. And they're most commonly seen in myopia. In myopic eyes, you have these artifacts. Okay.
Dr. Sugato there. Yeah. Team score is
0.
Team score remains 0 with this. Now, best of luck for the rapid fire round with Dr. Sugato.
So you have 30 seconds. So remember, if you can't answer, just deep pass and go back if time permits. Okay. So here comes the first question. What is the volume of the vitreous? Plus minus 1. We'll take.
Pass.
Which anti-tubercular drug can cause cataract?
Pass.
pass.
K spot is seen after which operation?
Keratoplasty.
Next, commonest cause of overdepression in adduction is?
Superior oblique pass. Brown syndrome.
Fundus autofluorescence is, your time is up, but the
Lipofuscin in
question-
RP.
sorry?
Lipofuscin in RP layers.
Okay. So the first question you passed, but after that he answered 5 but didn't say ml, but we'll take that as 0 because you answered pass first. Isoniazide, you what did the answer, Shilpi?
I did.
We didn't answer.
Pass.
We-
Yeah. So keratoplasty is right. Very well answered. These are punctate epithelial opacity anterior to the suture line. Well done. Superior oblique overaction, you got right. And retinal pigment epithelium layer, you got right. So you got
Plus
30, well played.
Thank you, sir.
33 rights, well played.
Thank you, sir.
Sai, team Pizza Pie is raising hand. I think they are not in this. Can you just check once?
Just a minute, ma'am.
Yeah, meanwhile, we'll go with the
The
next
next
team
team.
and we will have them later. So help them out in logging in. Probably they are having some problem with that. So
SLF.
now it's time for us to move to team SLFK from Jipmer, Pondicherry. We have Dr. Salva and Dr. Farnaz. Can you get your video as well as audio on? Yes, welcome. So
Thank you,
do
sir.
introduce yourself in a sentence and also tell about your mentor.
I'm Dr. Farnaz. I'm Dr. Salva. Both are final year residents and our mentor is Dr. Nirupa ma'am.
Okay, fine. So over to you, ma'am, Purvi ma'am, for a clinic-based round.
All the best, SLFK.
Thank you.
And the question is that a patient underwent pars plana vitrectomy with cataract extraction with the PCIL implantation for traumatic detachment and cataract. He now complains of intermittent visual blurring and has an IOP of 28 millimeters of mercury and has this clinical picture. And the questions are, what would be the cause of raised IOP in this case?
Silicon oil in like overfill.
Okay, which characteristic of the material causes this type of an appearance? 3 seconds left. Which other complications can be associated with this?
Band-shaped keratopathy.
Can we have the answers, please? This is not silicon oil. Silicon oil causes inverse hypopyon. This is retained PFCL in the anterior chamber. And because it's a regular type of a hypopyon picture, it's because of the high density. Okay, that is why it sinks to the bottom. And keratopathy, okay, maybe we can grant. The other complication is uveitis.
Okay. So,
Plus 5 from this round.
Yes, yeah.
so now over to you, Dr. Sugatoda.
So here comes your first question. Are you ready?
Yes, sir.
Yeah. Which part of the orbicularis oculi is known as Horner's muscle?
Pass.
At what angle the gonioscopy lens have their mirror set? You can give a range.
Okay. 59 degree.
Okay, next question. Anterior remnant of the hyaloid artery is known as?
The pass.
Your time is up. Unfortunately, you took too much time in the first question.
First question, yeah.
Yeah, so these are the rest of the questions which were quite easy for you. The fourth one was quite easy, but unfortunately, you ran out of time. So we'll reveal the answer. So 59 will take as right answer, as you was within the range. You didn't answer the first question and you didn't answer the third question. So we'll give 10 marks to the team.
Okay.
So plus 10 from this round.
Yes, plus 10.
Only 2 teams. This is a video from our sponsor, Labs. So thank you, Microlabs, once more for sponsoring this particular event meant for All India Postgraduate Quiz. We are indeed indebted to you, the Brain Teaser team, and the gang is indebted to you for helping us out to second year in a sequence. So now it's time for... Yeah, it is now again. Let us go back to Dr. Arvind Maurya. It will be for all the teams to play. Now it is a MCQ round 2. So over to you, Dr. Arvind.
Thank you, Prashant sir. So I'm back with the next set of 5 MCQs. And the first MCQ is 70-year woman underwent right eye trabeculectomy for primary open-angle glaucoma. 24 hours after surgery, AC is shallow with IOP of 43 millimeter of Hg. Iridectomy appears patent. Most probable cause is A, Schwartz syndrome, B, iridoidschisis, or C, malignant glaucoma, or D, pupillary block glaucoma. And your time starts now. And the correct answer is malignant glaucoma. Can we have the explanation? Also known as ciliary block glaucoma or the aqueous misdirection in the absence of this suprachoroidal effusion or hemorrhage. Next MCQ, please. 25-year woman presented with painful right corneal ulcer with thick mucus adhered to the defect. 24 hours earlier, she scratched her right cornea while removing a soft contact lens. Causative organism is A, gram-positive coccus, B, gram-negative cocci, C, gram-positive bacillus, or gram-negative bacillus. And your time starts now. And the correct answer is gram-negative bacillus. That is Pseudomonas aeruginosa, because it is rapid onset and thick mucus at the ulcer site. Next MCQ, please. 70-year-old man develops vesicles in his right forehead, which are painful. The right eye is red and has mucus discharge. Diagnosis is by A, multinucleated cells and inclusion bodies on Zhang test, or B, grow on agar plate overlaid with E. coli, or C, stained with gomeri methanamine silver, or D, stained with Congo red. And your time starts now. And the correct answer is multinucleated cells and inclusion bodies on Zhang test. Explanation, please. So Zhang smear of fluid from vesicles that typically shows multinucleated cells and inclusion bodies, also seen in herpes simplex. Next MCQ, please. What is the diagnosis? A, papilloma, B, ocular surface squamous neoplasia, or C, melanosis, or D, pyogenic granuloma. And your time starts now. Look carefully at the histopathological slide. And the answer is A, conjunctival papilloma, because there are crowds of the epithelia as seen in the histopathological slides. Next MCQ, please. All are true about TINU, that is tubulointerstitial nephritis uveitis syndrome, except A, the median age is 15 years of age, B, females are more frequently affected than males, or C, sarcoidosis is the most commonest cause, or D, the most common type of uveitis in TINU syndrome is bilateral anterior uveitis. And your time starts now. And the correct answer is C, sarcoidosis is the most common cause. It affects the young females, and sarcoidosis needs to be excluded because it's in the DD. Next MCQ, please.
So we are over with the MCQs.
Okay. Over to you, Dr. Shilpi.
Yeah. So now it's again back to teams, individual teams. It will be now time for us to play with the next team. So do we have Pizza Pie team with us now?
Doctor, they seemingly have an issue with their instrument or device. They're rejoining with a different device.
Okay, so we will be playing with the next team. So it is going to be team SLF.
Wizard side.
Yeah, SLF क्या हो गया ना? Team Wizard side from Arvind Eye Hospital, Coimbatore. So can we have you there with us?
Yes,
Get
sir.
your
Good
video
evening, sir. Good evening, sir.
So please do introduce yourself as well as
Good evening. I'm Dr. Sumaya, secondary DNB resident from Arvind Eye Hospital, Coimbatore. Good evening, everyone. I'm Dr. Nikita from Arvind Eye Hospital, Coimbatore, secondary DNB resident, and our mentor is Amruta Sindhu ma'am. She is also with us today. She is consultant in pediatric ophthalmology at our hospital.
Thank you. Thank you, Team Wizard and the mentor, Dr. Amrita, for being with us. Now I hand it over the proceedings to Dr. Purvi Madam for the clinic based round.
Thank you. All the best, Team Wizard, and keep your wines ready. So patient is brought to the emergency OPD with the following appearance in the left eye following a cricket ball injury. He complains of pain, swelling, and sensitivity to light. Visual acuity is 618, and there is limited supraduction. Posterior segment is normal, right eye is normal. And the questions are, what would you suspect clinically?
Floor of orbit fracture.
Next question, please. What other signs may be commonly present in this
Hyphema.
eye?
Hyphema, angle recession, glaucoma.
What would be the indications for surgery?
If the hyphema is not controlled, if it is muscle
total
restriction, hyphema or orbital nerve decompression, EOM restriction, inferior entrapment in the floor.
Okay, your time is up. We'll have the answers. The first one is right. It's an orbital floor fracture because there is restriction of movement. There is a muscle entrapment also. The other signs commonly would be present is globtosis, infraorbital nerve hypoesthesia, and lid emphysema. And the indications for surgery and removal of the entrapped muscle is if there is persistent diplopia and muscle entrapment, enophthalmos, and facial asymmetry. So you get one right and two wrong.
Muscle entrapment, they said.
Muscle entrapment.
For the last one, okay. You want 10 more marks?
So it will be, ma'am, plus 15.
20.
Plus 15, ma'am. Minus 5.
Okay. Minus 5, yes.
Now let's play on with the rapid fire round with Dr. Sugato.
Yeah, best wishes. So here comes your first question. Which type of gland is the gland of Zeiss?
Pass.
Next, what is the magnification of 20 diopter lens?
5.
Next, Segre streak is seen in which structure of the eye?
Pass.
Next, Copernicus Galileo pre-studies are for which ocular condition?
CRVO. Vein occlusion.
Next, Matter grading system is used for?
Pass.
Okay. So you passed the first question, which is modified sebaceous gland. Magnification of 20 diopter lens is 3 times I would have taken. 5 is wrong. You passed the third question, in hypertrophic choroidopathy. Retinal vein occlusion, I'll take as the right answer. And myotic grading is used for studying IOL glistening. So you got 1 wrong and 1 right. Past 3.
Yes.
So well played, team. That side. Now it's time for us to move to the next team that is again from Jipmer. Jipmerites. So they are Jipmerites, Dr. Gautam and Dr. Anupreet. Anupreet. So can we have it to you? Ask with you. Yeah, welcome. So you were missing some time back when we commented on this guy's room, kept or unkept or whatever it is. So what do you have your impression about the room in which you are seated right now? Just you can comment. I don't think he will hit you in front of us in the screen.
It's fine. Like,
Gautam, you are so imposing on her. You don't let her clear, huh? Okay, fine. Now, to introduce yourself and your mentor.
I'm Dr.
I'm Dr. Gautam.
I'm Dr. Anadi.
Our mentor is Dr. Nirupama ma'am from Jaipur.
Okay, welcome. Over to you, ma'am.
Yeah, thank you. Yes, all the best, Team Jipmer. So 38-year-old male complains of intermittent red irritated eyes in some years. His symptoms are worse in the morning. He has no other significant ocular history or other clinical findings. Systemically, he suffers from obesity and hyperlipidemia. And the questions are, what condition could have led to these findings in both eyes?
Juvenile xanthographic.
What other systemic condition could be associated with this?
Pass.
Last question, if the patient is not willing for surgery, what advice would you give?
Control his lipid profile and don't rub his eyes.
Can we have the answers? So basically, it's a case of floppy eyelid syndrome. Okay, obesity, hyperlipidemia, more in the morning, and the characteristic papillary conjunctivitis point to floppy eyelid syndrome. The commonest systemic condition associated would be sleep apnea in these cases. And if the patient is not willing to undergo any lid surgeries, all you advise is taping or patching of the lid eyes during sleep.
So, how much is the score?
-10.
So
Yeah,
you get
-10.
-10.
-10.
Gautam and Anurit, now come on, get up. It's time for you to get back the score and get back into the race. You have rapid fire round with Dr. Sugotoda. So Sugotoda, you have 50 marks to gain from.
So here comes your first question. What is the direction of the nasolacrimal duct?
Downward, medially, and backwards.
Next, magnification of 78 diopter lens.
Pass.
Next, Stoker lines is seen in
Pterygium.
Sorry?
Pterygium.
Stereopsis is best in which principle?
Pass.
The condition with extra rows of eyelashes is known as
Trichiasis. So the magnification of 78D lens is 1.1.
Trichiasis.
Your time is actually already up. Otherwise you would have got negative marking for that. So direction of the nasolacrimal duct is downward, outward, not medially, it's basically laterally and backward. So we'll give negative marking for that. Magnification of the 78 diopter lens is 9.38 or 1. Stoker lines is seen in pterygium, and Tierno-test is the principal use is anaglipin, and the extra row of eyelashes is dystrichiasis, which you got wrong as well. So I think you got 2 wrong and asked rest of the questions. Is that right, Shilpi?
One right.
Pterygium
Was right. Question number 3.
Pterygium there. Okay.
So they get 0 out of this score.
Okay.
So well played, team. And now it's time for us.
So shall we give 5 marks or negative marking for the nasolacrimal duct one? I'll go to the other quizzer, Purvi, Dr. Bhagat, and Dr. Arvind. They got downward, they got backward, but they turned the lacrimal duct inward instead of outward.
Yeah, I don't think this should be given because this is actually very important when you explain massage to the patient.
So negative, we should give negative marking.
Agreed.
Yeah. So it will be negative marking. Yeah. Okay.
Okay, sir. We go ahead with whatever finally the quiz masters.
So they got 0. Yeah. Okay. 0 for this round.
Correct. So now it's time for us to play with the next team. Team is going to be Oculus Reparo, and it is from LV Prasad Eye Institute, Hyderabad. And for that, representing them is Dr. Prapti and Dr. Neet. Are you there with us, Dr. Prapti?
Yes, sir. Yes, we are here.
Okay, just introduce yourself in short and as well as tell about your mentor, and then we'll go ahead with the next round.
Okay. Good evening, everyone. I'm Prapti.
And I am Neet.
And our mentor is Dr. Gaura.
Okay. Over to you, ma'am. Purvi, ma'am.
All the best, Team Oculus. So a 70-year-old man complains of gradual dimness of vision and occasional photopsias and a positive scotoma in the left eye since 3 months. And this is the fundus picture. And your time starts now with these questions. What is your clinical suspicion?
Malignant melanoma,
What would be the treatment in this case?
excision or enucleation.
Third one, please. What would be the prognosis based on?
Involvement of the sclera.
Your time is up. The first question, yes, you got it right. It's choroidal melanoma. The treatment would be enucleation. It's a large tumor. And the prognosis in these cases is based on the histopathology of the tumor. Okay. It's known as the calendar classification. Can you have the next slide, please, Dr. Shilpi? So depending on whether it's a spindle A type, B type, or their epithelioid types, the prognosis would be either good, intermediate, or the worst in case of epithelioid cells. Okay.
They get 2 right and 1
Like
wrong.
2 right and 1 wrong.
So plus 15.
Plus
Well
15
played.
on this round. And so now over to you, Dr. Sugato.
Yeah. Here comes your first question. Where is the valve of Hasnart present?
At the opening of the nasolacrimal duct in the inferior meatus.
Next question. Dallenfuch's nodule is seen in
Sympathetic of
Sympathetic occlusion.
Ferry's line in the cornea is seen in.
under the bleb, trabeculectomy bleb.
What is the measuring range of the manual keratometer for radius of curvature?
38 to 56.
Radius of curvature. Okay. Duas layer is located anterior to which corneal layer?
Descemet
Membrane.
Okay. Can we go back to the answer, please? So lower end of nasolacrimal duct is right. Sympathetic ophthalmitis is right, but you answered something else in the beginning. What shall we do to the admin?
We let the 2 other quiz masters decide it. Yes, madam and Arvind.
I think they corrected it in the next attempt. So I think they should be given marks. It's my suggestion.
Filtering bleb is right.
Thank you.
Now, I asked for the radius of curvature, so you got this wrong. And Descemet membrane is right. So you have done very well. So you got 4 right and 1 wrong, which gives you 35. Is that right?
Yeah, very well played, of course.
Very well played.
Very well played.
Thank
So
you.
now it's time for us to move on to the one-liners, and Dr. Arvind Maurya is back with his one-liners for round 2 of one-liners.
Thank you, Prashant sir. So I am back. So first question is, different areas of lens will form foci in planes other than chief focus, which produces in the image plane A, this is a fill in the blank effect from a point source of light. And your time starts now. And the correct answer is?
Sir, 1 second. Sir,
Okay.
we did not get the quiz on the Kahoot platform actually.
Sorry, okay, we will wait.
So we also didn't get it.
Sai?
What is?
No, it's hung, madam. It's on now.
Yeah, we give you another 10 seconds to play.
Okay, different areas of lens will form foci in planes other than chief focus, which produces in the image plane a fill in the blanks effect from a point source of light. And your time starts now. 10 seconds.
So time is up.
Just a
Can you
moment.
give the
madam.
answer, Sai?
Can show the answer.
And the answer is comma. Next, which virtual erect image of an object is formed by which lens? The simplest of all. Your time starts now. Virtual erect.
Hold on, madam. Hold on, please.
Yeah, sure.
Can show the answer.
And the correct answer is concave. Next question, please. Unscramble the word. And your time starts now.
Hold on, madam.
Yeah, sure.
Can display the answer.
Yeah, and the correct answer is focal length. Next, sixth layer of cornea from anterior to posterior is, and your timer starts now. From anterior to posterior.
Hold on, madam. Can show the answer.
And the correct answer is endothelia. Duas layer is the fourth layer. Next, please. Eyelids, eyebrows, conjunctiva, and lacrimal apparatus are known as eye, and your time starts now.
Hold on, madam. Yeah, can show.
And the answer is eye appendages. Over to you, Dr. Shilpi.
Thank you, Dr. Arvind, for taking us through the last round of one-liners. Now it's time for us to play with the last two teams who are left over. So we have the next team which is going to play is from team Sabdarjung, Dr. Nishi and Dr. Dhwani. Are you there with us?
Good evening, sir.
Good evening. So please introduce yourself as well as your mentor.
I'm Dr. Dhwani Agarwal, final year resident from Sabdarjung Hospital. And Dr. Nishi Satish, again, final year resident from Sabdarjung Hospital. And our mentor is Dr. Anurag Narula, sir. He's with us today.
He's with us. Welcome, Dr. Anurag. You must be proud to see your team into the semi-finals. Can we have you with, can you get your video input on, sir?
Sir, he might not be available, right?
Okay, fine. So it's time for us to play the next round with you, Team Sabdarjung. Dr. Purvi ma'am, over to you.
Yeah, thank you. All the best, girls.
Thank you.
So 47-year-old sportsman complains of flashes and some dark shadows in the inferior nasal field of one eye just since 2 days. On slit lamp examination, some pigments, which as you can see in the photograph, they are seen behind the lens. There is no history of surgery and the other eye is normal. And the questions begin now with the timer. What would be your first clinical suspicion?
Rhegmatogenous RD.
What is the pigmentation behind lens in such cases called?
Tobacco dust, Sheffer's sign.
Which other condition leads to such pigmentation?
Retinal tears.
Okay. So the time is up and you get 2 answers right.
Cataracts.
Yeah. So it occurs in retinal detachment. It is called Sheffer's sign or tobacco dusting, and a similar dusting occurs also in cataract surgery, post-cataract surgery. Okay. So you get 2 right and 1 wrong. So that's 15 points.
So over to you, Sugatada, for the rapid round.
So best wishes, and here comes your first question. What is the volume of the orbit? Plus minus 2.
Range 30 ml.
Okay. How many points are tested in 10-2 visual field?
68.
Okay. Residual sign is seen in,
Keratoconus.
okay, wavelength of double frequency ND,
592 nanometers.
which nanotech, with nanotech and AI,
Pass.
what is Elenza? Okay, so well played. So 30 cc is right. Point tested in 10-2 is 68, not 60. Keratoconus you got right.
So we said 68.
Oh, you said 68. Oh, sorry. I heard 60. Okay. Now, India double frequency I asked.
Yes.
Got it wrong. And Elenza is an IOL. So you got 1, 2, 3 right. You could have got the fourth one right as well. If you have listened to the question carefully. So 25 the scores.
Yes. I think we can correct the fourth question, sir. Wavelength of double frequency NDAG is 532. It should be. NDAG has 1064, no? I think.
Yeah,
Double.
yeah.
Double
I think there is some 532. Correct.
32, yes.
Yes, I think we will. What did their team say?
They said 532.
We take them as a positive answer. Correct answer. I'm serious. Wrong. Some.
It will be plus 40.
Yeah.
Yeah, correct. Okay. So well played, team. So now let us move to the last team. It is going to be the team Pizza Pie. Team Pizza Pie, are you there with us?
Yes, sir.
Yeah.
Yes.
So please introduce yourself as well as tell us about your mentor.
I am Dr. Rehana, final year DNB resident, Little Flower Hospital, Angamali.
I am Dr. Vishnu Priya from Little Flower Hospital, Angamali. Our mentor is Dr. Elizabeth Joseph, senior consultant, pediatric ophthalmology.
She's with us.
Yes.
She has logged in with us.
Yes, sir.
Madam, are you there with us? We would
Yeah,
like to...
I'm there. I'm there. Am I audible?
Yeah, yes, ma'am. Welcome to Brain Teaser. Means
Thank you. All the best. May the best team win. Our students, all the best to the students.
Yeah, thank you, madam, and thank you for being with us. How does it feel to have your own team into the semi-finals of All India?
Very proud of them. We are very proud of them. Very nice.
Thank you, madam, for being with us. We will be chatting with you after the completion of this round. So stay with us. And thank you.
Purvi ma'am.
Yeah. Yes, Dr. Shilpi. And all the best, team Pizza Pie. So 30 years female is concerned about these kinds of brown spots in her left eye, which keep appearing and increasing and decreasing. The rest of her history and clinical examination is normal. Questions and timers start now. What is your probable diagnosis?
Conjunctival melanosis.
When should you suspect this to be a malignancy?
If the size is increasing, the color is increasing, irregular surface.
Which additional lesion will you look for?
Sentinel vessel. Madam.
Okay, the time is up. Can we have the answers? It's primary acquired melanosis. I think we can give them. When should you suspect this to be a malignancy? We can give 50% of the marks. It's either it becomes nodular from a flat lesion, it enlarges, or you can see vessels, especially feeder vessels. And in these cases, the additional lesion that you need to look for is a choroidal melanoma. Okay. So for the last one, you get -5.
10, ma'am.
So plus 10, you well played, team. And now it's over to Dr. Sugato with the rapid fire round for last 30 seconds of today's quiz. Sugato,
Okay. Yeah, I'm here. Here comes the first question. So saccades originate from the contralateral what?
Frontal eye field.
Most probable diagnosis here?
Fracture floor of orbit.
Okay. Most probable diagnosis?
CRAO. Artery occlusion.
Okay. Central toxic keratopathy is a rare complication of? Okay. Next.
True, sir.
Okay. My screen has gone. So here comes the answer. So saccades, what did you answer?
correctly. He answered frontal eye. That is correct.
Okay. Okay, fractured floor of the orbit is correct. Sorry.
Third was wrong. They said CRAO.
Yeah. And corneal, you passed this, and last one was right. You said true.
So it is plus 25.
1, 2, yeah, plus 25. You got well played. Well played.
So well played team from Little Flower Hospital, Angamali. Of course, it must be very, in fact, feeling good for Madam Elizabeth, Madam, the way that her team played today. So now it's time for us to declare the
semi-finalist 2 list.
Semi-finalist 2 list before we proceed on to the sharing. So the next semi-finals will be on the coming Wednesday. That is going to be the 5th of April at 8 p.m. But the teams would have to log in by 7:30. So this is the least next 11 teams we will be playing semi-finals 2 with us. So it is House of Dragon team from Coimbatore Medical College, then RP Center, that is Team PG, then APC from Jipmar again, YP from St. John's Hospital, Bangalore, one more team from PGIMS Rohtak, then Basveshwara Medical College, Chitradurga, IGMC Shimla, AIMS Raipur, Nair Hospital, Regional Eye Hospital, Kurnool, and RIO Achievers PGIMS Rohtak. So these are the 11 teams which are going to play with us the next set of semi-finals. Now let us move on to we will be stopping the sharing of the screen. Now it's time for us to interact with the mentors. So I request all the mentors as well as the team members to now get their video as well as audio on. So we see the mentors who are there with us. We have team, yes, mentor Dr. Elizabeth Joseph, ma'am, from Little Flower Hospital. I think she is the director. We are so happy, madam, that in spite of your busy schedule today, you are with us for encouraging your team played extremely well. So it must be quite gratifying for you as a teacher. We can't hear you. You need to unmute, ma'am.
Yeah, it was nice witnessing today's quiz program. It was very well conducted, and my students did very well. So I'm happy for them. I congratulate them, and congratulations to everyone else.
Thank you, madam. So how did you find the overall quiz program? Last time, I think
it was very good. The standard of questions were very good. And it's very difficult to find such questions to ask them. That also it's a big job, to get questions, select quiz masters. It was very nicely done.
Thank you, madam, for your kind words. In fact, the whole credit goes to the gang of brain teasers. We have the quiz masters from across the country who are representing some of them, like Dr. Sugato Paul. Is a private practitioner, but he's an avid quiz master. He finds time. I would like to share at this particular point of time, Dr. Sugato Da has undergone some small surgery for his thing and he couldn't spell out the words. But he said, I have committed you, and he loves students like that. He said, in spite of his having some problem in telling his words, he accepted and he said, I will be part of it, because it's fun to be with these young brains. So thank you, Sugato, for being with us. And this is the level of our quiz masters, their commitment that makes this program so successful, ma'am.
That is the spirit. Yeah, that is the spirit of the quiz masters, spirit of the academicians, true academician.
Very true. Sugato, we can't hear you. You are muted.
Last month, actually, I underwent partial glossectomy with lymph node dissection. So I thought this will be the best option to come back to the normal world, but my speech is still a bit affected, but I hope you could understood what I was asking.
Sir, we could hear you and we salute your spirit. Rather, I should see every one of us. I think we need to laud the effort of this man, the way he fought back. He needs a big applause from all of us.
Yeah, get well.
You came with a bang.
Yeah, he came with
That's up to you.
Yeah.
Thank you.
So, in fact, Sugato Da and Madam Elizabeth, Madam, exactly this is why our quiz level is going every day up and up and up.
Yeah, quiz masters like him. true
Yeah.
academicians
Very
and
true.
highly spirited people.
Thank you. Thank you. Thank
Wish
you.
you
And
I
guys-
actually learned a lot from Arvind's and Dr. Bhagat's questions. Very, very well thought of questions, actually. A lot to learn from your questions, both of you.
everyone, every quiz master contributes and is raising the standard. And in fact, it is the mentors like Madam Dr. Amrita there, Dr. Chavan sir, who makes us more proud. We look at the commitment of these mentors. At this time of hour of the day, it is 9:30 in the night, and they are standing so strongly behind their own mentees, rather, I should say. It speaks about their commitment and the way we can see this young brains working together, answering those answers so difficult. In fact, if I look at it, 90% of the questions I didn't know the answer. These guys, young guys, could answer so spontaneously, so fast. I salute, and I think it is the efforts of the mentors behind them who are standing so strongly with them. We salute you all, the mentors, ma'am. We have Dr. Amruta there. Yes, madam, you are smiling there.
Yes, sir. I would say it's all their efforts because I was just there mentally supporting them. But all the work, all the hard work is by those two people. In fact, they're actually first year residents, and I see most of the participants are actually final year or third year residents. I'm quite proud of them. They work really hard. They spend a lot of time preparing for the quiz. And in fact, a big salute for the quiz team. It's a huge effort. I understand conducting an online quiz. You have to look into so many things like internet. So many people have to coordinate. It's quite a tough job, and you've done it so well, sir.
Thank you. Thank you.
Thank
But
you,
Dr.
thank you.
Purvi ma'am, do you accept the humility of Dr. Amrita, who says that she was only a mental support and nothing she contributed to the performance of the students? You yourself are a teacher. What do you think?
Yes, yes, yes. No, actually, all teachers are like this. So the main thing, actually, what we need to give is the moral support and the courage to them to face such platforms and come off on these platforms confidently. That is
Arvind, Arvind, you are also
Congratulations to
professor.
you, ma'am. The way you are grooming them. It's all your efforts. Congratulations.
Very well.
You are being so humble.
Yeah, that's what I also thought, because you don't want to take away the credit from your students who are absolutely first year resident, as you shared with us, but the way they performed, they needed some guidance, something without which they would not have performed so well. I respect your humility, but yeah, I think you should be given a due credit. That's what I thought. We also have one of the senior most professor, Professor Rajendra Singh Chavan sir. Chavan sir, are you there with us? He's another one of the mentors who is strongly behind them. Anurag Narula, Dr. Anurag is also with us.
Johan sir, can you unmute yourself?
Yes, Chavan sir. We have Dr. Indranil. Dr. Indranil is there with us.
Yes, sir. And now I am able to see you all. Yes.
Okay, thank you. Thank you for being with us, sir. So we have two most senior most faculties of our country. One is Dr. Chavan sir and Dr. Elizabeth Joseph. These are the two icons of teachers.
No,
Rather,
no, but they are not that
role models.
senior. They are quite young like you only.
No, sir. Dr. Chavan sir and Elizabeth madam, you are supposed to be the senior most teaching faculties of your respective state and across the country. Madam, you are muted. Madam, you are muted. And look, we are muted, madam. Madam, you are muted. We can't hear you. No, madam, we can't hear you.
Ma'am, kindly unmute yourself.
Unmute yourself. Yeah. Hello.
Actually, sometimes because these mobile phones, when we are logging in, sometimes it is difficult to see that.
Thank you. Thank you. So Chavan sir is one of the most senior most and most revered faculty from North, and madam is one of the most senior most and most revered faculty amongst the Kerala. I know I have moved in Kerala so many times, and the way people look at her in awe and as well as towards her, it speaks about their commitment to their students. See, because till we pass, we might have a forced respect, but people who have passed across the institute and still they salute you and look at you with an awe, speak about your commitment to the teaching. We salute you, ma'am, and well as Chavan sir. Your team is constantly doing as well.
Thank you, sir, so much.
Dr. Indranil, are you there with us? He's a young man.
Sir, good evening, sir.
भाई unmute कीजिए आप अपने आप को.
Yes, sir. Am I audible, sir?
Yeah, he's a generation of new young mentors, I believe.
Thank you so much, sir. It's really humbling to be in the amidst all these stalwarts. Dr. Chauhan, sir, ma'am, all of you, and the level of the quiz has been really incredible. And each team has performed so exceptional. I was looking at the questions and I was thinking, I myself don't know half of the things over there. It's like a good recap, sir.
Okay, fine, Dr. Indranil, your kind words. But we are proud that I was wondering, are we going to exhaust the teachers like Chauhan sir and Elizabeth madam? But we are seeing a new breed of teachers, and we are positive that our country has a good future.
New breed is always better than the older one.
No, सर आप लोगों का तो कोई बराबरी नहीं, बट नया जनरेशन भी इंडिया में अच्छे टीचर्स का आ रहा है, तो it spells good for the future of Indian ophthalmology. We have
it's because of the gems that have been instilled in us by stalwarts like you, sir.
Oh no, yaar, I'm not a teacher. I'm just a backbencher. But yes, we have two of the five senior faculties like Dr. Purvi and Dr. Arvind Maurya. Arvind Maurya representing a young generation. Purvi madam, some not senior, I should put her into the bracket. So thank you, Indranil, for being with us. And we have any other mentor.
Thank
Dr.
you,
Prashant Bankule.
Yeah.
Good evening. I want all the people to on the camera so that we can have in one frame all the people at one go.
Yeah. So all the team members, get your all video input on. All team members, all the mentors, let us have a group photo so that we can share it on the mails, on the Facebooks with you. Come on.
And after this, Sai,
Attendance.
ready with
It's
the
attendance time.
Yeah. Yeah.
Team Spark.
Team Spark. So that's a voice from our sponsor, Mr. Ashok, who is the Executive Vice President of Microvision, who had stood behind us so strongly since last 3-4 seasons and sponsoring us in such academic activities meant for the young brains. I think we are so thankful to you, Ashok sir.
Thank you. I've taken the photographs. Yes.
Yeah. You could? That's great.
Yes.
Sai, now just declare the audience names. Prizes?
Audience prizes for today's episode. There are 3 winners per episode. So we are sharing with you who are the prize winners. So it's the
Candy.
98475975. That's Rani, Jay, and Candy. Are you there with us? 3 of you, Candy, Jay, and Rani. We would love to have a look at people who played the audience round and performed so well in today's round. You can unmute yourself and come on the Zoom platform.
They need to message.
I'm quoting them.
Yeah.
You're quoting them? Yeah.
Attendees, they have one. Eye Candy is there. So you can promote.
Eye Candy, can you? Dr. Manisha, madam. I see Dr. Manisha Nadda with us. She's one of the professors.
Sai,
Yeah.
please, Manisha Nadda ma'am should be promoted to the panelist.
Eye Candy also. I think he's the prize winner. Yeah.
I have promoted both.
Yeah. Team Candy, can we have a look at you? Get your video on. Eye Candy, who is it? We would like to know who is this anonymous Candy.
Maybe Dr. Nada.
Manisha ma'am, where are you? Can you have your video input on? Again? Madam is yet to join, I believe. Yeah, she's yet to join. Candy? Achha, they have not yet. Sai, they have not yet joined?
They have joined.
And Manisha Nadda ma'am still is in attendance list, not in the panelist.
No, she declined, madam.
Okay. So
One team has joined. Jay has joined.
Jay, can you get yourself video on as well as audio? We would like to just interact and say congratulate you.
Good evening, Prashant. Good evening.
Who is that? Oh, sir.
Once again.
Sir.
Yeah.
I didn't
from
realize.
Trivandrum.
Yeah, I know you, sir. So,
Yeah.
sir is one of the most senior most participant in our team. Every time he participates and he wins it and he makes it. So, what keeps you in a quizzing at this age, at this point of time, at so late in the night? What interests you, sir?
Essentially, you will revise.
Okay.
You will really revise. What you have forgotten actually will come back. And I
Oh.
feel that helps me in my practice.
Okay.
I
So
think
that way, thank you very much,
money-
Prashant, and all the very best for you personally. And to the team, congratulations. You're doing a really good job. Okay.
Thank you. Thank
All
you.
right.
Thank you, sir. Your name, I couldn't make out, Jay. That's why I was wondering who is that.
No problem.
I
It
was
is
expecting a small
Jayaprasad.
young guy.
People call me JP, so you can call me JP. That is how I am known. Okay.
So
Yeah.
we have Elizabeth, madam, from your state. Madam, look at this man's stamina and his quest for knowledge. What do you say?
Yeah, Elizabeth
I would
madam
like
is a
to
good
have a
friend of
comment
mine.
from madam. Madam, unmute yourself. A comment on Dr. JP. Unmute. Please unmute yourself, madam. Why can we unmute, madam?
She's unmuted, but she has an audio problem, sir.
Okay. Somehow we are not able to hear you, ma'am.
So JP sir is winning, I think, in every episode.
Yeah, he comes on and off. My goodness. And so we have
No, it
another.
really helps me, Prashant. I keep reading so that, so what you have forgotten all these 20, 25, 30, maybe 35 years of practice, I'm picking up now and I have students. So this helps me in teaching too. Thank you so much, Prashant. And the next person is Dr. Rani, who has come third. She is the medical director of my institution, Amardeep Eye Care at Trivandrum and Kollam.
Okay, where is she? She is not logged in. We would like to interact with her.
Okay. I think I cannot contact her right now.
No issues, sir. Thank you for being with us and keep playing, sir. Your prizes will be delivered to you in a short while. Besides your interest in quizzing, I know prize is just a matter. Okay. So Candy, who are the
And all the very best.
Thank you, sir.
Yeah.
Candy, can you unmute yourself? And who are the sweet candies? We can't hear you. Unmute yourself. No. Your network is poor.
So these teams are one of the teams who are playing constantly, and today they are not in the semi-finals. Still, they played in the audience round.
Very well played. So that's the spirit, dear. Keep on playing, and you will be winning. Okay. Chalo. Congratulations once more, all the audiences who participated and have won the prizes. And we salute your stamina, Dr. JP and the team Candy and everyone. So it's time for us to today now take a leave from every one of you. Thank you, all the quiz master, Dr. Purvi, Dr. Arvind, Dr. Sugata. I know making questions and creating such a question bank after having already exhausted last 12 episodes, you mean we had such a small margin of, and we didn't have any repetition. That was the great thing. I salute your efforts for making this big Q such a phenomenal, which is appreciated by senior teachers and professors like Chavan sir, Elizabeth madam, and everyone. And they keep us following us like Dr. JP, a senior ophthalmologist from Kerala. So thank you, everyone. I would also thank all the mentors who logged in so late and were standing behind their teams, encouraging them and motivating them to play so well. And of course, all the participants who participated in today's episodes, besides the 11 teams who participated. So best of luck. And so we will be meeting again on the following Wednesday, coming Wednesday, I should say, at 8 p.m. The teams have to log in by 7:30. We would request the mentors who want to watch their teams to log in by 7:45. And till then, it's time for us to sign off from this end. Thank you once more, everyone. Thank you. Good night.
Thank you so very much, sir, for the opportunity.
Thank you. Thank you.
इसमें पता नहीं, मतलब वो रिजल्ट आएगा बाद में।